Hi, my name is Dr. Sean Pittock. I'm a neurologist at the Mayo Clinic. I'm co-director of the Neuromyelitis Laboratory, and I'm going to talk to you today a little bit about Neuromyelitis Optica. At the Mayo Clinic, we have a Mayo Nmo Consortium, a group of Nmo investigators who feel passionately about this disease and who have been working on this disease, many of them for the last 10 years. We are interested in the translational activities, in other words, trying to perfect and improve the laboratory-based testing that we have to improve its sensitivity and specificity for the disease. And to try and learn about how can we take a patient's blood sample into the laboratory and how can we develop assays or tests on that blood sample that might be predictive of how a patient might do, or might help direct how we might approach treating a patient. We have other investigators here who are developing animal models of the disease, which I think will be very important, not only in terms of understanding the etiology or the pathogenesis of the disease, but also in terms of the development of new therapeutic approaches to the disease. We have groups here who have an interest in the immunopathology of the disease and who have made great strides in understanding the immunopathology of MS and have now really begun to take part in the core interest of understanding the differences immunopathologically between MS and NMO. And those investigators now are an intricate part of our NMO consortium. We have investigators that are interested in the genetics of NMO, identifying the possibility of a mutation in the water channel gene that might potentially increase the likelihood of developing the disease or increase the likelihood of developing an immune attack against the water channel. We've now recruited people with interest in the imaging of both the brain and spinal cord, not only in humans but also in animals, which also will play an important role in the work we're doing with our animal models of the disease. We have an interest in clinical trials. We have done a lot of the original work on not only steroid treatments for acute attacks, but also the work on the plasmapheresis treatments for acute attacks. We've also had an interest in investigating the benefits of immunosuppressant medications in neuromyelitis optica. We are currently recruiting patients for an open label trial of a drug called eculizumab in NMO. And that trial really stems from our laboratory-based research, where we identified that complement is very much playing a role in the pathogenesis of the disease. And eculizumab is a monoclonal antibody that blocks complement activation, and therefore it made sense from our laboratory-based findings and also some findings from the immunopathology of this disease that if you could block activation of complement, maybe we could prevent disease or prevent attacks. And so currently we have an open label study that's currently running, and depending on the results of that study, if it is positive, then we may move forward into a larger clinical trial. So there's a lot of very exciting things going on in the field of NMO. There's been a great advance. There is a dramatic support now for furthering research in this orphan type disease. There are many institutions that are invested in furthering our understanding of this condition, and I think that the future of NMO research is very bright, and we're lucky to have groups like the Guthrie Jackson Charitable Foundation to help support and drive this effort.